Okay, next we have Avi sir with us. Avi sir, do we have you?
Yes. Hi Gunjan, am I audible?
Yes, yes, you're perfectly audible. Okay, so let's spin the wheel for you. Get endocrinology. Okay, let's see. Okay, this one's easy. Most common cranial nerve involved in the pituitary apoplexy: optic nerve, abducens nerve, oculomotor nerve, and the facial nerve. I repeat the question. Most common cranial nerve involved in the pituitary apoplexy: optic nerve, abducens nerve, oculomotor nerve, and facial nerve.
Okay. In pituitary apoplexy.
Yes.
Should we optic? Back. So you obviously consider optic chiasma along with it, right? So I would go with optic.
Okay, I'm afraid, but that is incorrect. The correct answer is oculomotor nerve, and you get a -5 for that.
All right.
Okay. Who's left? Shraddha, is anybody left, or are we done with the round one?
No, we're done with round one. And the
Okay.
scores for round one are
Yes.
Avisa -5, Chitwan 20, Pratyush 20, Sanika -5, Sanjay 20, Kartavya -5, Ajish -5, Jasmine -5, and Gunteshwar 20.
No, I think we're left with Varnik.
Okay.
Oh
Okay.
yeah, he just joined.
Yeah, just a moment. I'll share my screen back. Okay. Hi, Varnik.
Hello, Gunjan.
How are you?
Am I audible?
Yes, you are
I'm
perfectly
good, thank you. Oh,
audible. Can you please have your video on, if possible?
yeah, sure.
Excuse me. Hi Gunjan.
Hi. Until then. Okay, we have CVS with us,
Okay.
and your question is: okay, where are the most common drivers of atrial fibrillation anatomically located? Left atrial appendage, mitral annulus, pulmonary vein orifice, sinus venosus. Where are the most common drivers of atrial fibrillation anatomically located? Left atrial appendage, mitral annulus, pulmonary vein orifice, and sinus venosus.
Uh, I want to skip this question. Can I?
Okay, perfect. So Shraddha, we award him 0 marks. Okay, so let's begin with the round two. Shraddha, who we have first? Do we have Chitwan first?
Yes, we have Chitwan first.
Okay, Chitwan. Chitwan, can you have your hair, please?
Yeah, yeah, hi. I am here.
Hi. Hematology and oncology.
Yeah, okay.
I know you don't like that, but that's okay. Okay. All the following are hallmarks of malignancy except self-sufficiency in growth signals, sustained angiogenesis, evasion of apoptosis, sensitivity to growth inhibitory signals. All the following are hallmarks of malignancy except self-sufficiency in growth signals, sensitivity to growth inhibitory signals, sustained angiogenesis, and evasion of apoptosis.
is it option B, the growth inhibitory signal sensitivity?
Yes, perfect, perfect. You get a plus 20. Okay, Shraddha, who do we have next?
Next we have Pratyush.
Okay, Pratyush, can we have you on screen, please?
Yes, yes, I'm here.
Okay, perfect. Let's spin the wheel for you. Immunology and oncology yet again. Okay. Congenital causes of hypercoagulable states includes all except protein C deficiency, protein S deficiency, MTHFR mutation, lupus anticoagulant. I repeat the question. Congenital cause of hypercoagulable states includes all except MTHFR mutation and lupus anticoagulant.
Okay. So, was anticoagulant?
I am so happy. It is perfectly correct. A plus 20 again.
Thank you so much.
Okay, who do we have next, Shraddha?
Next we have Sanika.
Okay,
Yeah,
Sanika,
I'm
can we
here.
have you on screen, please? Okay, so here's the wheel spin for you. Which of the following is true regarding Wilson's disease? Early diagnosis is crucial as highly effective therapy is available. It is inherited in an autosomal dominant pattern. Serum copper levels are usually 2 or 3 times above normal. The frequency of disease in the general population is almost 1%. I repeat the question. Which of the following is true of Wilson's disease? Early diagnosis is crucial as highly effective therapy is available. It is inherited in an autosomal dominant pattern. Serum copper levels are usually 2 or 3 times above normal. The frequency of disease in the general population is almost 1%.
Your timer has started.
I'm sorry, but the question was which of the following is correct, right, or is incorrect?
Yes. Which of the
True.
following is true of Wilson's
Okay.
disease?
I think it is early diagnosis is crucial because effective therapy is available.
It is correct. Great job, Sanika. You get a plus 20. Okay.
Next we have Sanjay.
Okay, Sanjay. Okay. Sanjay, can we have you on the screen, please? Perfect. It is respiratory system. Let's see what we have got for you. Okay. Number of amino acids in CFTR gene responsible for cystic fibrosis. 1480, 1481, 1456, 1433. Number of amino acids in CFTR gene responsible for cystic fibrosis. 1480, 1 and 1433.
I'd like to skip this one.
Are you gonna give up?
Yeah.
So Shraddha, we award him 0 for this.
Okay, next we have Kartavya.
Okay. Kartavya, can we have you on screen, please?
Yeah, hello, I'm here.
Yeah, okay, let's spin the wheel for you. Okay, let's have psychiatry and special services. Okay, let's have this. Which of the following is not a feature of tubercular otitis media? Earache, multiple perforations, pale granulations, foul smelling ear discharge. I repeat, which of the following is not a feature of tubercular otitis media? Earache, multiple perforations, pale granulations, and foul smelling ear discharge.
Could you repeat the first two options, please?
Earache,
Earache and
perforations.
I would like to go with perforation.
I'm afraid, but that is incorrect. The correct answer is earache. You will be awarded -5 for this.
Next we have Ajish.
Okay, Ajish, can we have you on screen, please? Ajish, can we have you on screen, please?
Yes.
Okay, here you go. Skin and connective tissue. Okay, so this is a multiple answer correct question. How many of the following statements are true regarding osteomalacia? Craniotabes, genu valgum, pseudofracture, metaphyseal fraying, decreased PTH, osteopenia. And your options are 4, 5, 3, or 2. I repeat the question. How many of the following statements are true regarding osteomalacia? Craniotabes, genu valgum, pseudofracture, metaphyseal fraying, decreased PTH, osteopenia. Your options are 4, 5, 3, or 2.
3.
Pardon?
3.
I'm afraid that is incorrect. The correct answer is 4. The following are correct: craniotabes, pseudofracture, metaphyseal fraying, and osteopenia. Shraddha, we award him -5.
Next we have Jasmine.
Okay, Jasmine, can we have you on the screen, please?
Yeah.
Okay, Jasmine. Okay. Let's see what we have got in stock for you. Okay. Extrarenal manifestations of autosomal dominant polycystic kidney disease are all except mitral valve prolapse, berry aneurysm, pulmonary cyst, colonic diverticulitis, and arachnoid cyst. I repeat the question. Extrarenal manifestations of autosomal dominant polycystic kidney disease are all except mitral valve prolapse, berry aneurysm, pulmonary cyst, colonic diverticulitis, and arachnoid cyst.
I would like to go with colonic diverticulitis.
I'm afraid, but that is incorrect. The correct answer is pulmonary cyst, and you'll be awarded -5 for this.
Next, we have Gunteshwar.
Okay, Gunteshwar, can we have you on screen, please?
Yeah.
Hi, Gunteshwar. Let's spin the wheel and see what's there for you. Okay. All of the following disorders may be associated with thoracic aortic aneurysm except osteogenesis imperfecta, Takayasu arteritis, Klinefelter syndrome, and Ehlers-Danlos syndrome. I repeat, all of the following disorders may be associated with thoracic aortic aneurysm except osteogenesis imperfecta, Takayasu arteritis, Ehlers-Danlos syndrome, and Klinefelter syndrome.
Thankfully, I read cardiology just a few days ago. So the answer is Klinefelter syndrome.
Congratulations, that is absolutely correct, and you get a +20.
Next, we have Avi sir.
Avi sir, can we have you on screen, please?
Yes.
Yes, you've got your favorite topic.
Now that is pressurizing, na?
Don't worry, you're gonna do.
Last one also.
Okay, let's see what we have for you. Okay. What is the most common cause of meningitis in a 20-year-old patient? Streptococcus pneumoniae, Staph aureus, Neisseria meningitis, H. influenza. I repeat the question. Which of the following is the most common cause of meningitis in a 20-year-old patient? Streptococcus pneumoniae, Staph aureus, Neisseria meningitis, and H. influenza.
Okay. So, if you consider him sexually active, but otherwise also I think strep pneumonia should be the most common cause for meningitis, you said, right? So I would want to go with strep pneumonia.
And it is absolutely correct, and you get +20. Finally.
This is less of CNS, this is more of micro.
At last, we have Varnik.
Okay, Varnik, can we have you on screen, please?
Yeah.
Okay, here's the spin for you. System. Okay. X-ray chest finding of Spinnaker cell sign is seen in pneumothorax, pneumoperitoneum, pneumomediastinum, obstructive sleep apnea. X-ray chest finding of Spinnaker cell sign is seen in pneumothorax, pneumoperitoneum, pneumomediastinum, and obstructive sleep apnea.
Is it pneumomediastinum?
Yes, it is perfectly correct, and you get a +20. Shraddha, can we have the scores, please?
The scores after the 2 rounds are Chitwan at +40, Pratyush at +40, Sanika at 15, Sanjay at 20, Kartavya at -10, Ajish at -10, Jasmine at -10, Kunteshwar at +40, Avisa at +15, and Varnik at 20.
Okay. This is the last round for this round. This is the finals when we have the top 5 out of this. Okay. Let's begin with Chitwan. Chitwan, can we have you on screen, please?
Am I audible, visible?
Yes, yes, you're audible and visible. Okay. Which
I
of the
don't know what's wrong with this wheel today. Okay.
Which of the following is not an example of euvolemic hyponatremia? Endurance spots, beer potomania, Addison's disease, and hypothyroidism. Which of the following is not an example of euvolemic hyponatremia? Endurance sports, beer potomania, Addison's disease, and hypothyroidism.
Is it Addison's?
It is Addison's, and you guessed a plus 20, and I guess you get a perfect of plus 60 score in this round, I guess. Am I correct, Shraddha?
Thank you so much.
Okay, who do we have next, Shraddha?
Yes, you're right. Next, we have Pratyush.
Okay, Pratyush.
Yes, I'm here. If I'm audible and visible.
EIT and hepatitis. All of the following are the causes of drug-induced esophagitis except potassium chloride, iron, tetracyclines, cephalosporins, bisphosphonates. All of the following are causes of drug-induced esophagitis except potassium chloride, iron, tetracyclines, cephalosporins, and bisphosphonates.
Okay. So I think the answer should be cephalosporins because I don't think they cause drug-induced esophagitis. The cephalosporins. My answer would be.
It absolutely correct. And you get a plus 60. I mean a plus 20 and a total of plus 60.
Next, we have Sanika.
Okay, Sanika.
Yes, I'm here.
And let's see what we have got. Okay, you already got reproductive ones, right? Okay, no worries. We'll see what we have for you in stock. Okay, all of the following are known risk factors for development of ovarian carcinoma except family history of ovarian carcinoma, use of oral contraceptive pills, use of clomiphene, and BRCA positive individual. BRCA1 positive individual, I should say. I repeat the question. Which of the following? All of the following are known risk factors for development of ovarian carcinoma except family history of ovarian carcinoma, use of oral contraceptive pills, use of clomiphene, BRCA1 positive individual.
I'd like to go with use of oral contraceptives, B.
It is absolutely correct, and you get a plus 20. Okay, Shraddha.
Next, we have Sanjay.
Okay, Sanjay, can we have you on screen, please?
Yeah.
Okay. Okay. Azoospermia with absent vas deferens, primary infertility, and normal testes is a feature of CFTR mutation, AIS, Mullerian degeneration, congenital adrenal hyperplasia. Azoospermia with absent vas deferens, primary infertility, and normal testes is a feature of CFTR mutation, AIS, Mullerian degeneration, congenital adrenal hyperplasia.
3FTR.
And it is absolutely correct. And you get a plus 20.
Next, we have Kartavya.
Okay, Kartavya, can we have you on screen, please? Okay, so let's spin the wheel and let's see what's there for you. Okay, which is false regarding ASD? Murmur presents early in the course of disease. Shunt murmur is absent. Pulmonary plethora leads to pulmonary artery hypertension. Flow murmur is present leading to mid-diastolic murmur. I repeat, false regarding ASD. Murmur presents early in the course of disease. Shunt murmur is absent. Pulmonary plethora leads to pulmonary artery hypertension. Flow murmur is present leading to mid-diastolic murmur.
I need to tell which one is the false, right?
Yes.
I think it will be A.
You mean murmur early in the course of disease?
Yeah.
And it is absolutely correct. You get a plus 20. Shraddha, am I audible?
Yes, you are. Next, we have Ajish.
It says my internet connection is unstable, hence I asked. Okay, Ajish, let's see what we have for you in store. Central nervous system, neurology. Okay, let's see. Dash is a peripheral decarboxylase inhibitor. Benzerazidine, benzotropine, tetrabenazine, tribexylphenidine. I repeat, Dash is a peripheral decarboxylase inhibitor. Benzerazide, benzotropine, tetrabenzene, tribexyphenydiol. I'm sorry, the names are too confusing.
Benzasathide.
Pardon?
A. First option.
Okay, it
First option.
absolutely correct, and you get a plus 20. Okay, who do we have next, Shraddha?
Next, we have Jasmine.
Okay, Jasmine, can we have you on screen, please?
Yeah.
Jasmine, are you there?
Yes, I'm.
Okay. Let's see. Okay. Okay. Which of the following congenital heart diseases causes fixed splitting of the second heart sound? This one's easy. Which of the following congenital heart defects causes fixed splitting of the second heart sound? Atrial septal defect, Epstein anomaly, patent foramen ovale, tetralogy of Fallot, and ventricular septal defect. I repeat the question. Which of the following congenital heart defects causes fixed splitting of the second heart sound? ASD, that is atrial septal defect, Epstein anomaly, patent foramen ovale, tetralogy of Fallot, and ventricular septal defect.
I would like to go with AST.
And it is absolutely correct. Congratulations, you get a plus 20.
Next, we have Gunteshwar.
Okay, can we have you on screen, Gunteshwar, our General Secretary?
Stop there.
It stopped there.
Yeah.
Okay, let's see what we have for you in store. Okay, this one's easy. Which of the following is not false regarding chronic mesenteric ischemia? I repeat, which of the following is not false regarding chronic mesenteric ischemia? Empty stomach epigastric pain, arteriosclerosis of the celiac disease, sorry, it is celiac artery, not celiac disease, weight loss, thumbprint sign. Which of the following is not false regarding chronic mesenteric ischemia? Empty stomach epigastric pain, arteriosclerosis of the celiac artery, weight loss, and thumbprint sign.
Is it weight loss?
Yes, it is weight loss, and you get a plus 20.
Thank God.
Next, we have Avisa.
Avi sir, can we have you on screen, please?
Hi, yes, Gunjan, am I audible?
Yes, you are. Has this wheel for you. A 10-year-old child presents with impaired social interaction, impaired communication, and stereotyped behavior. He has a normal IQ and language skills. What is the most probable diagnosis? Asperger's syndrome, Rett syndrome, autism, childhood depression. I repeat the question. A 10-year-old child presents with impaired social interaction, impaired communication, and stereotyped behavior. He has normal IQ and language skills. What is the most probable diagnosis? Asperger's syndrome, autism, Rett syndrome, and childhood depression.
Okay. So since he's 10 years old, it cannot be Rett because that's supposed to be before that. Should be Asperger syndrome because it's basically a part of autism spectrum disorder itself. So I would, could you just repeat Asperger's, the four options once again?
Asperger's syndrome, autism, Rett syndrome, and childhood depression.
So it's specifically only autism, right? So impaired IQ. I would want to go with Asperger syndrome.
The IQ is normal, sir.
See, if you've mentioned it as autism spectrum disorder, if you mean that, I would want to go with autism spectrum disorder. But if it is just autism,
No, it means autism spectrum disorder, sir.
then it's autism spectrum disorder. That's the clear option. So then I would want to go with PSD.
Okay. And it is absolutely correct. And you get a plus 20. Next, we have Varnik, I guess.
Yeah.
Varnik, can we have you on screen, please?
Yeah, sure.
Okay, so here's the screen. All of the following are causes of SIADH except cerebral toxoplasmosis, oat cell tumor, hypothalamic glioma, indomethacin, vincristine. All of the following are causes of SIADH except cerebral toxoplasmosis, oat cell tumor, hypothalamic glioma, and indomethacin and vincristine. Sorry.
Yeah, please repeat the options.
Cerebral toxoplasmosis, oat cell tumor, hypothalamic glioma, indomethacin, and vincristine.
Is it hypothalamic glioma?
I'm afraid, but that's incorrect. The correct answer is indomethacin. And you get a -5 for this. Okay, did we miss Sanika and Sanjay? Shraddha, can we have the scores, please?
Okay, the scores for the final scores are Chitwan at plus 60, Pratyush at plus 60, Sanika at 35, Sanjay at 40, Kartavya at 10, Ajish at 10, Jasmine at 10, Kunteshwar at 60, Avisa at 35, and Varnik at 15.
Okay, so who do we have as top 5?
So the top 5 would be Chitwan with 60, Ratkish with 60, Gunteshwar with 60, Sanjay with 40, and then we have a tie between Avi sir and Sanika at 35 each.
Okay, so Sanika and Avisar, we can have a special round for you, and then the one who gets a higher score will go to proceed to +5, or top 5, I mean.
Right.
Okay, so who wants to go first, Sanika or Avisar?
Do you not have a tiebreaker for that also?
No, we don't have that.
Okay, I think I'll go first.
Okay, you want to go first? Okay, let's see. I don't know, Sanika.
Are you kidding me?
This wheel has a special affection for you. It always gets you to reproduction. Okay. Okay. So here's a short case study for you. A 64-year-old man noted pain with burning on urination a week ago. He has had discomfort in his scrotum for past 2 days. On examination, the right testis is swollen and tender. Which of the following organisms is most likely to cause this man's illness? E. coli, human papillomavirus, mumps virus, Mycobacterium tuberculosis, Treponema pallidum. Oh, and we move again. A 64-year-old man noted pain with burning on urination a week ago. He has had discomfort in his scrotum for the past 2 days. On examination, the right testis is swollen and tender. Which of the following organisms is most likely to cause this man's illness? Escherichia coli, human papillomavirus, mumps virus, Mycobacterium tuberculosis, Treponema pallidum.
How much time do I have left?
You have 52 seconds.
I'm going to go with E. coli.
Okay, and it is absolutely correct. And you get a plus. Okay, don't count. Okay, don't count the score. Okay, Avi sir, now now even if you guys get a tiebreaker, I'm gonna consider your prelim score. Okay. Avi said, do you like that?
I am pretty numb, so I'm okay with anything right now.
Yes, I know. Okay, let's see. What we've got for you in store? Okay. Which of the following is not a component of triad for gonococcal arthritis? Tenosynovitis, polyarthralgia, dermatitis, and polyarthritis. I repeat, which of the following is not a component of triad for gonococcal arthritis? Tenosynovitis, polyarthralgia, dermatitis, and polyarthritis.
Okay. So how much time do we have?
Shraddha?
You get a minute, and the minute has started.
So tenosynovitis is there, dermatitis is there. It's between polyarthralgia and polyarthritis. So because it causes polyarthritis, so arthritis for sure. In terms of septic arthritis, I would want to go with polyarthralgia is not a part of the triad. Is my answer.
Pardon? Can I have the answer again?
The answer I want to give is polyarthralgia.
Okay. I'm afraid that is incorrect. The correct answer is polyarthritis. It does not cause polyarthritis. And so the triad includes tenosynovitis, polyarthralgia, and dermatitis. So, Sanika, you move to top 5.
Avi is already the Green Lantern. He does not need any superpower.
So, Avi sir does not get the superpower, but he can trade around. Is that
Okay,
okay?
that is fine.
Okay, perfect. So, we have, pardon?
Sorry, continue, Milind, continue.
Shraddha, who we have first?
First, we have Chitwan.
Okay, Chitwan, you have the golden opportunity. I'll be reading out the superpowers, and you have the golden opportunity to select whatever, whichever superpower you wish to choose. Okay, and you may use at any time. We have 2 rounds in finals, and you may choose them anytime you need. But you have to inform before I complete before your timer starts, or probably before your question is said. The moment I say your name, you need to say that I need this superpower in this round. Okay? Does this work? So here's it. Superpowers for top 5, actually for top 6. Okay. Mycoplasma, Cryptococcus, Neisseria, Yersinia, Clostridium. Mycoplasma, pleomorphic, respin the wheel. Then we have Cryptococcus, encapsulated, no negative points even if answered incorrectly. Neisseria, diplococci, double your points. Yersinia, epidemics, -10 for all except you. Clostridium, toxin producing, hence freeze your time. So for the finals, we have only 30 seconds per question. So you would have to answer within that. And okay, what do you wish to choose?
Okay,
Chitwan?
so I think I need the diplococci one, the Neisseria. I think that's the most genuine one.
Okay, great. Who do we have next? Is it Gunteshwar with plus 60?
Pratyush and Gunteshwar both have plus 60.
Okay, so we have Pratyush next because since he had more in prelims. So Pratyush, what would you like to choose?
Okay. So I just have a doubt. So Cryptococcus was for what was Cryptococcus power? Respin the wheel, no negative points. Okay. I'm ahead. I think Yersinia is the one which causes -10 to rest everyone, right?
Yes.
Yeah, so I'll go with Yersinia.
Okay.
Thank you.
Okay, Gunteshwar, what do you want to choose?
Thing is, they've taken my first priority and second priority. What do I choose now?
I'll help you take your senior.
Yes, I already taken.
Acha, you took your senior. Oh shit.
Mycoplasma is respin. Cryptococcus is
Freezes the time. Oh, sorry.
no negative point.
This is no negative marks.
Okay. I'll just take mycoplasma.
Okay, respin the wheel. Okay.
So I can respin the wheel after you say the question. Okay.
No.
The system.
That's the system.
This is not done. Yeah, come on. Yeah. At least give me something. He can deduct. He can deduct points. She can double her points. What can I do? Just respin the system.
Yes.
Not done. Yeah.
You have to say the response after I spin the wheel, everybody. So it's up to you. Okay, decide what do you want to choose.
No, mycoplasma is there.
Chalo, theek hai. We have the respin the wheel for you.
Avi is the saddest person right now.
Shraddha, you're noting it down now?
Yeah.
Okay, who do we have next? Shraddha, who do we have?
I'm so sorry. Next we have Sanika. Oh, sorry. Next we have, yeah, Sanika.
Sanika?
No. Sanjay is next. I'm so sorry.
Sanjay, what do you wish to choose?
Cryptococcus.
Okay, Cryptococcus. So hence, Sanika is listed Clostridium only.
I actually wanted Clostridium from the start. I don't know why. So I got it.
That's perfect. So, Shraddha, can you please repeat the superpowers for everybody
Okay,
once?
Chitwan has Nesaria, which is double the points. Pratyush has Yersinia, which is -10 for everybody except him. Gunteshwar has Mycoplasma, which is spin the wheel again before the question is asked. And Sanjay has, just a second. Sanjay has Cryptococcus, which is no negative marks for that round. And Sanika has Clostridium, which is freeze the timer.
Okay, Avi sir, no, we don't have a superpower like that. The spin for this as well. Okay, Avi sir.
Why not? Yeah.
The wheel also wants you. Let's begin.
All right. I'd like to use my power. So yeah, makes sense.
You don't have a power, sir. You
I'll
have
use it in both the rounds. I'm the only one who can use it in both the rounds, right?
Yes, yes, perfect. Okay, where is that technology gone? Just a moment. Okay. A 40-year-old man, known case of chronic renal failure, develops Rugger's jersey spine. The probable cause is aluminium intoxication, osteoporosis, osteomalacia, secondary hyperparathyroidism. I
Renal
repeat,
osteodystrophy, secondary hyperparathyroidism. Option D.
okay, it is perfectly correct, and you get a plus 20. He does not also want me to repeat the question again. He's like, I am very confident about this.
I just don't want a controversy. I'm happy with that. So yeah, you can move on to the next one.
Let's see who is the next person. I am really sorry. It is Sanika, and it is
Yeah,
a typo.
it's okay.
It's a typo. Okay. I am telling you this has some affinity for renal system.
Okay, I don't want to use my superpower in this round.
Okay. Okay, it is a multiple option correct question. The question is, differentials of bilateral enlarged kidneys are amyloidosis, HIV associated nephropathy, renal vein thrombosis, diabetes mellitus early stages, cyclosporin. Differentials of bilaterally enlarged kidneys are amyloidosis, HIV associated nephropathy, renal vein thrombosis, diabetes mellitus early stages, and cyclosporin.
Can I please have the options again? Amyloidosis, HIV,
HIV associated nephropathy, renal vein thrombosis, diabetes mellitus, cyclosporin.
amyloidosis is going to be there.
Okay.
Then
The time is up.
renal vein thrombosis and diabetes mellitus.
Okay, but your answer is still incorrect. The answer is amyloidosis, HIV associated nephropathy, and diabetes mellitus.
Okay.
And you get a -10.
Okay, I have a doubt. Like for these multiple options correct questions, if I have my answer correct and it's partially incorrect, then what happens to me?
Okay, so let's consider this. Since Anika had two options correct, Sanika, sorry, we'll award her half marks, plus 10. Okay.
Wow, that's great.
Since let's be fair with everybody. Since we have only a few multiple choice correct, so let's be fair with her. And so Hale wants add after every. Let's see who we have next. What happened to this now? No, we can't have Avisar again. We have Chitran. Let's see, Chitran. We have. Let's see what we've got for Chitran. Oh, this one's easy. Glioma shows
I know it's not.
Glioma shows overexpression of PDGF beta, ERB1, RET, KIT. I repeat, glioma shows overexpression of PDGF beta, ERB1, RET, and KIT.
I think I'll go with PDGF beta.
It is absolutely correct, and you get a plus 20. Okay, let's see. Okay, Chitwan Gunteshwar Satsa.
Yeah, Gunjan. Spin my system.
Anji, oh my god, oh my god. इतना coincidence, इतना ज़्यादा.
Oh.
बताओ जी, spin करना है दोबारा? You want to use your superpower? This one's actually easy. MYC is a cell cycle regulator, nuclear regulatory protein, growth factor, or a growth factor receptor.
Thank you.
MYC gene is a cell cycle regulator, nuclear regulatory protein, growth factor, and growth factor receptor.
Yeah. Thankfully, I know this. It is a nuclear regulatory protein.
I told you this one's easy.
Yeah,
and it is absolutely correct. You get a plus 20.
Okay, so it's reproduction, so I'll use my superpower.
Okay, only if you get the question correct.
Yep. Give me an easy one, please.
I can't promise that. Okay.
So what comes after A in the alphabet?
B. Okay. All of the following features association with HPV-16 infection, marked dysplasia and hyperproliferative epidermis as seen as characteristic histological finding, intact basement membrane, virtually never develops into an invasive carcinoma. I repeat, which of the all of the following statements are true for Bowen's disease except strong association with HPV-16 infection, marked dysplasia and hyperproliferative epidermis seen as the characteristic histological finding, intact basement membrane, virtually never develops into an invasive carcinoma.
Okay, so I think it's Bowen's disease. So the first three were correct. So I think the correct answer is D. That is virtually never develops into an invasive carcinoma because I don't think.
It is absolutely correct, and you get a plus 20, and everybody gets a minus 10.
Yeah.
I hate you, Kathy.
Don't worry, Chitwan, you'll double your points anytime soon.
Testicular atrophy may be caused by all except cryptorchidism, cirrhosis, mumps or orchitis, torsion kidney. Testicular atrophy may be caused by all except cryptorchidism, cirrhosis, mumps or orchitis, and torsion kidney.
Torsion kidney.
It is absolutely correct. You get a plus 20.
Plus 10 because the superpower.
Yes, yes, yes. Okay, Shraddha,
Okay,
can we
the
have the
scores
scores,
after
please?
round 1 are Chitwan at 10, Pratyush at 20, Sanika at 0, Sanjay at 10, Kunteshwar at 10, and Avisar at 10.
Okay, everybody, let's begin. Okay, let's see what we have got for you. You like that?
Yeah, now I'm happy. Yeah, we can use my superpower now.
Only if you get the question correct. Okay, you want a tough question or an easy question? Let's see what we've got for you. Okay, it is not tough. Okay, which of the following statements is not true regarding molecular pathogenesis of colorectal carcinoma? Overexpression of COX-1 leads to its development. NSAIDs are chemoprotective. Loss of APC gene. Mutation of KRAS gene. I repeat, which of the following statements is not true regarding molecular pathogenesis of colorectal carcinoma? Overexpression of COX-1 leads to its development. NSAIDs are chemoprotective. Loss of APC gene. Mutation of KRAS.
I think it's the overexpression of COX-1.
And it is absolutely correct, and you get a plus 40. Chitan is already done. निकाल लो अपना बायो वेपन और आंसर दे दो अब फटाफट.
I sense controversy. Okay.
Let's see what we have got for you. This one's actually easy. Cough on scratching the external acoustic canal is due to auriculotemporal nerve, auricular branch of vagus, facial nerve, great auricular nerve. I repeat, cough on scratching the external acoustic canal is due to auriculotemporal nerve, auricular branch of vagus, facial nerve, and great auricular nerve.
Okay. Should be the branch of vagus.
It is, and it is absolutely correct, and you get a plus 20.
Thank you.
Okay, let's see who do we have next. Okay, it is. Oh my god.
Bro, you could just hide the slices. The people who are done, you could just hide that slice and that will not show anything.
You have hidden Sanika. Okay. It is by mistake. Okay. Sanika, we have you.
And I will use my last round anyway, so I have to.
You want to use the superpower?
I think we'll take the system first.
time will freeze after this.
Okay.
Um, okay. Which condition is not associated with sinus bradycardia? Brucellosis, leptospirosis, typhoid fever, advanced liver disease. I repeat, which condition isn't associated with sinus bradycardia? Brucellosis, leptospirosis, typhoid fever, advanced liver disease.
I'll go with advanced liver disease.
And I'm afraid, but that is incorrect. The correct answer is leptospirosis, and you get a -10. Okay. We have. Should you want to use the superpower? Okay, you can decide after I spin.
Yeah, I'd like to use my superpower. Please spin again. Okay. Yeah.
Let's see what we do. Mutation of ALK receptor is seen in which of the following tumors? Colon cancer, breast carcinoma, glioma, neuroblastoma. Mutation of ALK receptor is seen in which of the following tumors? Colon carcinoma, breast carcinoma, glioma, and neuroblastoma.
I think neuroblastoma. Like I'm gonna go for neuroblastoma. Hopefully.
Okay. And your answer is correct. And you get a +20. Okay, let's see. So we have Sanjay and Pratyush left, right? Sanjay.
I'll be using the superpower.
Okay. Shraddha, you wanted to use a superpower. Can you repeat your superpower, please?
Superpower is that even if he answers incorrectly, there will be no negative marking.
Okay, perfect. Okay, so here's a case for you. A 28-year-old female has had fever, pelvic pain, and a feeling of pelvic heaviness for a past week. Pelvic examination shows a palpable, painful left adnexal mass. Just a moment. Okay. Laparoscopy shows an indistinct left fallopian tube that is part of a 5 centimeter circumscribed red tan mass involving the left adnexal region. Which of the following infectious agents is the most likely cause to produce these findings? Chlamydia trachomatis, H. ducreyi, herpes simplex virus, Mycobacterium tuberculosis, Treponema pallidum. I repeat the case scenario again. A 28-year-old female has had fever, pelvic pain, and a feeling of pelvic heaviness For the past week, pelvic examination shows a palpable, painful left adnexal mass. Laparoscopy shows an indistinct left fallopian tube that is part of a 5 centimeter circumscribed red tan mass involving the left adnexal region. Which of the following infectious agents is most likely to produce these findings? Chlamydia trachomatis, H. ducreyi, herpes simplex virus, Mycobacterium tuberculosis, Treponema.
Yeah. I'd like to go with Mycobacterium tuberculosis.
I'm afraid your answer is incorrect. The correct answer is Chlamydia trachomatis, but he doesn't get a deduction, right? He has the superpower. Let's move on to the last person, and that is Pratyush.
Hello.
Hi Pratyush, welcome back. And you are the last contestant for this round. Skeletal, skin, and connective tissue. Let's see what we have for you in stores. Okay. Okay. It's a short case study. A 25-year-old boy was playing a basketball match and tried to block the basketball shot and had a sudden fall. Which of the following nerves is most likely to be injured in this case? Radial nerve, median nerve, axillary nerve, and musculoskeletal nerve.
So I think it's, please repeat the question once more.
A 25-year-old boy was playing a basketball match and tried to block the basketball shot and had a sudden fall. Which of the following nerves is most likely to be injured in this case? Radial nerve, axillary nerve, median nerve, and musculoskeletal nerve.
I think as his sudden fall in basketball, so it should be axillary nerve.
It is axillary nerve for sure, and you get a plus 20. Because his arm is in vulnerable arm position, abducted, extended, and external rotated. Okay. Shraddha, can we have the final scores?
The final scores are Chitwan with Chitwan with 50, Pratyush with 40, Gunteshwar and Avisa with 30, Sanjay with 10, and Sanika with -10.
Okay. So Avisar and Gunteshwar, you won a tiebreaker.
But very well done. Thank you so much, Guntu.
Thank you. Okay, we can just have a photograph. Wait.
ਜੇ ਕਿਤੇ ਪ੍ਰਤਿਊਸ਼ ਕੋਲ ਨਾ ਹੁੰਦਾ ਨਾ ਯਾਰ ਸੀਨੀਆ ਮੈਂ ਤੇ ਅਭੀ ਵੀਰ ਉੱਪਰ ਹੋਣਾ ਸੀ ਅੱਜ
Okay, can everybody turn on their videos, please? Ajish, Jasmine, Sanjay. Okay, Shraddha, can we have a photograph, please?
Yeah, sure. Okay, 1, 2, 3. Do you want one more?
Yes, we can pose, I'm suppose.